One of the most common questions we get about CoolSculpting is how can something that is non-invasive, that just uses a little bit of cold, work? And the answer is that fat is very susceptible to cold. How? The best way to think about it is if I took a stick of butter and I took a glass of water and we put it outside in a 100-degree day, what's going to happen? The butter will melt, the water will stay the same. Butter is more susceptible to heat. Fat is the same way, except for now instead of heat, we're talking about cold. So we lower the temperature to a specific point where the skin, the nerves, all the surrounding tissue is fine, but the fat isn't. And so the fat cells die. Now, the body doesn't like cells that aren't healthy. And so there's a natural mechanism to go in there and remove those cells. So what do? We cool the cells down to a point. The fat cells die within 2 to 3 days, and then over the next several months, in a slow process, your body removes all those dead fat cells, resulting in a diminishment of the fat cells, a changing in body contouring, or a changing of the bulge, or a changing in your dress size, or your pant size. CoolSculpting can treat a multitude of areas. We have an applicator that came out a little over a year ago that can treat the double chin. We have applicators that can treat the upper stomach, the lower stomach, love handles, below the bra. So those areas where a bra and a tight shirt creates a bulge. We can treat inner thighs and we can treat outer thighs. And those are all the areas that are FDA cleared that has shown proof through treatments, technology, and science that we can do safely and effectively. So when we treat patients, number one, the process is so easy that there's a little bit of skepticism. And once they have the treatment, because it was so easy, it didn't hurt, and they leave but they have not seen a result, that skepticism might be a little bit reinforced. But as time goes on, and time being 3-4 weeks, and they start to see that little bit of shift, it's human tendency to say, okay, I spent money on a procedure. It has to work. So I look at myself and you start to say, okay, it's working, but I'm not sure. And they might convince themselves. And that's that 3 to 4 week mark. So every time we see patients back at the 3 to 4 week mark, they'll say, I think I see change one day. The next day I'm like, oh, I don't see change. Once we get to 5-6 weeks, they start to say, this really works. I can't believe it. And that's the point where they say, where else can I treat? But now we're just on the journey. Roughly at 8 weeks, we're seeing half the results, and at 12 weeks, we're seeing 90 to 95% of the results. The average patient, if we were to treat love handles and lower abdomen, may see roughly an inch reduction. Now that's not enough fat, since we're being so localized in what we're doing. While fat has weight, it's not a correlation into the scale. It's a correlation into I dropped a size, or the little bit of a bulge I had in my lower stomach isn't hanging over my pant line. Those are the things that we start to see. Men can be treated, women can be treated. Obviously, when we look at a man, we want to sculpt or contour differently than a woman. I mean, classically, women want to be hourglass shaped. Men, it's a V shape. So while we look at them differently, fat is fat. And so if we treat fat on a man or we treat fat in a woman, it works. So it's great. So I feel very fortunate with my relationship with CoolSculpting. And my patients feel fortunate because they know that their treatments are being done by the person who trains everybody else. But there's a level of trust here with me, knowing that we're current, we know how to get the best results, we know with the new protocols, the new applicators, and the new technology, that not only will we have it, but we know how to utilize it. And then there's a lot of comfort for patients and a lot of trust.